My name is, yes, my name is Jeffrey Thompson. I'm an occupational health nurse. I work at the Occupational Health Center, and I'm very pleased to present and host our session today with Andrea. And I will read her bio here in a second, but I just wanted to share a little bit with we have a large group here, 180 people registered. So if we get that many folks, that would be wonderful. I work at the Occupational Health Center. We're a small community health center here in Winnipeg, and we focus on folks who need support with an injury or a claim with workers' compensation. And we do a lot of workplace outreach and prevention. We work with newcomers. We're kind of Manitoba's best kept secret. So we're going to be sure we share our contact information and our website through the chat so you don't lose it. But really, the other piece here is the Manitoba Occupational Health Nurse Interest Group, or MONIG. So this small association, I'm the treasurer, and MONIG is hosting Andrea today to present on neurodiversity. We're very excited to have her. And MONIG is a provincial association for folks who aren't necessarily occupational health nurses, but are interested in that as a specialty. Any nurse from any profession or any discipline or specialty, I should say, is welcome to join. And we are not just limited to Manitoba. There have been some changes nationally that have kind of expanded our profile a little bit, and we're trying to draw new members. It only costs $30 a year. It's tax deductible, and it would be wonderful if you could join us. We do education sessions 2-3 times a year, and we have our AGM. And so it's a great opportunity to network and learn from others in the field. Whether you are credentialed or not, or certified, doesn't matter. If you have an interest, it's in our name. We'd love to have you. So we will send out some information over chat about how to join. I'm the treasurer. It usually involves just sending me an email, and you can do it that way. So without further ado, I'd like to welcome Andrea McPhail.
Mm-hmm.
Andrea was born and raised on Treaty 1 territory in Winnipeg, Manitoba, and is proud of her Irish, Métis, Ojibwe, Cree, and European descent. She brings a wealth of experience from her diverse background as a high-performance athlete, coach, and public school teacher, and is now embracing this chapter of life as a counseling therapist, wife, and mom. Andrea believes that every person is unique and deserves to be heard, valued, and accepted exactly as they are. Drawing from her work with individuals, professional athletes, and teams, as well as corporate organizations, she uses a collaborative, multimodal approach to meet clients where they're at, not where they think they should be. Deeply passionate about neurodiversity, Andrea advocates for greater understanding and inclusion of all ways of thinking and being. She brings this lens into her counseling and community work, fostering environments that celebrate differences and empower people to thrive as their authentic selves. So one more note before I pass the baton. We will hopefully have some time for questions at the end, so please stick around. Otherwise, Andrea is going to share ways that you can connect with her, and that sounds great. So thank you, Andrea. I will pass it over to you.
Thank you. Oh, I was listening. I'm like, who wrote that bio? All right. So thank you so much. I'm going to share my screen and thank you everyone for having me here. We're talking today about neurodiversity in the workplace. And I'm just gonna get this one full screen here. All right. So neurodiversity in the workplace, definitely a hot topic right now. And so I'm really excited to be able to spend this time today to share this with you guys. This one's not going to work there. We're going to skip over that. We already did that one. Part of it, this is Jessica. We have a podcast. So I work with Tolo Mental Health and Performance, and then our sister company is Too Good Consulting. So Too Good Consulting is the corporate side of things, and then Tolo Mental Health is our counseling therapy and our sports psychology side of things. And so Too Good Side has a podcast, and so Jessica was one of our guests a while back. And she says tough conversations are a skill, and we have to practice this. And so I always like to make mention of this one because tough conversations are a skill and we only get better at them if we practice. And neurodiversity can also be a topic that can be difficult depending which position people are in. So hopefully today will make it a little bit easier everyone's coming with a different background. And so I've kind of started hopefully kind of at like the roots of things and then break it down a little bit more as to kind of what is neurodiversity, the language, what it may look like for us in the workplace. And then from there, what are some skills we can do to help with individuals with neurodiversity in the workplace? So if we're talking neuro, there's many different terms you may have heard, and then it's like, well, what do these terms mean? And then what are they? Oops, I'm going back. Sorry. Oh, no, I've gone the wrong way. There we go. This chat popped up. My apologies. What do they mean and how are they different and how do they apply to me in the workplace? So for neurodivergent, that's going to be kind of the term we refer to most today. But it's individuals whose brain function in a way that is different from what society considers normal or typical. And so it recognizes a natural variation, how the human brain works, differences in thinking, learning, attention, communication, and sensory processing. And so sometimes we don't really overanalyze these things. We just go, what is that? What's happening? Or why is that person doing that? That's weird. Not really thinking in the context of how it's all working, what's all going on. So neurodivergent is going to be what we look at most today. And then from there, we'll kind of break it down some more. So I've made kind of an umbrella here in terms of neurodivergence and what neurodivergent is. And so it is often it's a diagnosis of autism, which is also known as autism spectrum disorder, ASD, attention deficit hyperactive disorder, ADHD, dyscalculia, which is numbers, math, dysgraphia, writing, dyspraxia, coordination, dyslexia, reading. So you'll see these ones at the top of the umbrella, kind of in this first layer, are the more common ones. So ones that you would hear of more often, or that is more predominant in the workplace. And then from there, it kind of goes down. So I've got sensory processing disorder, Tourette syndrome, developmental disorders, synesthesia, not as common. And then there's also some psychiatric conditions. So OCD, bipolar disorder, effects from brain injury. These aren't necessarily recognized right away in the neurodivergent lens of things. So for the sense of time today, I'm going to be speaking more so to the top of our umbrella piece. Not that one is more important than the other, absolutely not the case. Just kind of for a scan of what we see the most of in the workplace right now. Neurotypical, so that would be individuals' brains functioning in a typical or societal standards. Important to note that neurotypical person may still experience stress or mental illness or learning challenges. And it doesn't mean that they're not having struggles. It just means that their struggles aren't due to a neurological difference. And so one thing to mention too, back to this neurodivergent piece, if we're talking about these diagnoses on the top here, they're due to a neurological difference. So actually like wiring of the brain. Neurodiverse describes a group, not an individual. And so it's a group of humans that would include a variety of different brain types and ways of thinking. So it could have neurotypical and neurodivergent individuals together. So it would be fair to say that any workplace, any school, any classroom would have a neurodiverse group of individuals because you would have some that are neurotypical, some that are neurodivergent, and everyone comes together to make it a neurodiverse group. And then to take that one further would be the neurodiversity. So this term emerged from the movement, which included both the neurotypical and neurodivergent brains together. So just encompassing the idea of acceptance and respect, strength-based perspectives, and then accessibility and accommodations. So just creating an environment where everyone can thrive and everyone can just be their best selves and their best humans and be successful. So to kind of shorten those terms up, I've made just a quick graph, kind of like a cheat sheet. And speaking of cheat sheet, I have kind of a cheat sheet that I've made as well at the end. So I will post a link where it's for a Google Doc, and then you click on the Google Doc, you can put your email if you're interested, and I can send it to you. Or as well, I think I'm also going to be Tiffany the document as well, and she can send it out to you guys as well. So neurodivergent describes an individual. Neurotypical describes an individual whose brains fit societal norms, Neurodiverse describes the group, and then neurodiversity, the concept or variation. And I should mention the neurodivergent piece describes an individual, and it would be with the neurodiverse piece of it. And so neurodivergent piece of it. So a diagnostic like ADHD, autism, um, dyslexia, any of those ones. So if we're comparing just to kind of get a real base understanding of what we're looking at, I've got one table here of neurotypical and then one table of neurodivergent. So for neurotypical, the brain functions align with society considered standard, and then neurodivergent would be brain functions different from societal norms or what society considers standard. And so neurotypical, typical patterns of attention, learning, social interaction, sensory processing. And then neurodivergent, they may process informations, emotions, or sensory input differently. And so it's, you see what I've done here kind of is presenting it the first way, and this will all make sense later on, in terms of definitions to give you that information. But now I've also given it to you in a chart. So depending who we're working with an individual, if someone's experiencing dyslexia, may not do the reading of the long definitions, but maybe the chart works easier for them. So I'm kind of incorporating some of these tools as we go through the presentation as well. So you can kind of take a look for some of those. For neurotypical, most systems, so schools, workplaces are designed with neurotypical people in mind. And then for neurodivergent, they often benefit from different supports or environments, not because they're lesser of ability by any means, but because systems weren't built for these differences. So there's been a shift, and I can say, like, from the classroom standpoint, there's been a huge shift in the last few years in looking at a classroom from a neuro diverse standpoint. And so you'll see classrooms that have a calming corner or have fidget tools in the classroom. Our office here, our clinic is located at the stadium, Princess Auto Stadium. And if you go to a Bomber game, there is a sensory room now that came into, I think that was finished for last season. So it's becoming more popular now. We're beginning to recognize these things. I think it was Safeway has sensory friendly shopping night where I can't remember, but it used to be on, say, Thursdays where they would dim the lights and there was no music on. And so it was a time when individuals could go and shop where it wasn't necessarily so overwhelming or the lights weren't so bright. So I think society is beginning to adapt some of these neurodivergent needs and incorporating them in to make a neurodiverse society. But this is kind of the breakdown of what would look like neurotypical to neurodivergent. So just a couple true or false, and we didn't know we were going to get such a great turnout. This is amazing. Thank you for being here with us. But I turned it kind of a little bit of a game. So neurodivergent, just true or false, you can just kind of answer to yourself and get an idea as to where you're at in terms of things. And so if we look at neurodivergent means disabled in all areas, true or false? People often have both challenges and strengths, true or false? Success often depends on accommodations, understanding, and environment. Neurodivergent people can't succeed in school or work. All neurodivergent people are alike. Neurodivergence includes a wide range of experience. And so if I click the answers, neurodivergent does not mean that you're disabled in all areas by any means. People often have both strengths, challenges and strengths, and we'll look at some of those shortly as we break down some of those neurodivergent areas. Success often depends on accommodations, understanding environment, absolutely. Neurodivergent people can absolutely succeed in school and work. All neurodivergent people are alike, absolutely false. And I'll talk about that more in a minute. And then neurodivergence includes a wide range of experiences. Absolutely. Everyone comes with something different and everyone brings something different to the table. Another one, especially kind of in our area of work, is terminology matters. And so shifting the language from disorder to difference. And I know there was a huge shift years ago when it was, even when I was in university, which was a long, long time ago, but it was instead of disability services, it was accessibility services, right? So changing the language and then also encouraging inclusion, accessibility, and accommodation. So we are getting to a place where accessibility and accommodations are becoming more recognized and more widely used. We still have a long way to go, but it's definitely made progress over the years. The terminology too, it's helping people understand themselves without a stigma, right? I know more than ever. And I don't know if it's algorithms or what, but you're seeing so many more moms coming out going, I was diagnosed with ADHD later in life, and now all of this makes sense to me. And it's like, yeah, it's not that I'm just chaos and disorganized and this and that. It's like, oh, that's how my brain is wired. And so when people begin to understand themselves, they can be kinder and gentler to themselves and begin to see what tools are going to help them work to get through things. And then avoiding stereotypes. So stereotypes lead people to not feeling safe. And then when people don't feel safe, they're not going to say something. So I know there is always full disclosure. I come from a whole family of neurodivergents, myself included. And so you'd be talking about something and then all of a sudden you're distracted and be like, oh, squirrel. And it kind of becomes a laugh and you're like, oh yeah. But then also at the same time, there's this stereotype, right? Of like, oh, you're always distracted or you can't stay on topic or you talk so much, you talk so fast. And sometimes those stereotypes, you hear them often enough that then it makes you feel not safe or not feel like you belong. And that can be really difficult too. So just being aware of that terminology is a big piece. So this is kind of similar to the umbrella, just a different way to visualize it. And like I mentioned, we're going to kind of talk about the top ones the most today, and then kind of move on from there a little bit. So if we're starting with autism spectrum disorder, differences in social communication, interaction, sensory processing, and behavior, you'll often see patterns of interest, and they often include strong focus. Um, with autism spectrum, there was also, it's also skipping my brain at the moment, but Asperger's. And so it's no longer called Asperger's. Asperger's is now a part of the autism spectrum disorder. And that one often has more weight on the social communication piece of things, the interaction, how individuals interact, but it all fits under this umbrella of the spectrum. And so you can be on many different levels, many different areas of the spectrum. Um, when you are dealing with autism spectrum disorder, it's often hard to understand what others are thinking or feeling. You get really anxious about social situations, find it hard to make friends, or often prefer to be on your own. May seem blunt or rude, or that you're not interested in others without meaning to. It's just, to the fact, to the point. Find it hard to say how you feel. And then it often affects social communication, interaction, and behaviors or patterns. And so I'm going to break it down even further. And a lot of our time, as I mentioned, will be spent on those top ones, but it'll be autism and ADHD as those two are the most common that we see right now. And also just to be able to give you tools to walk away with today to use either for yourself or a family member or in the workplace. So when we look at autism spectrum disorder, as I mentioned, it's the difference in social communication, sensory processing, behavior patterns of interest, cognitive learning style, and then support needs. And then there's often a really strong focus area. So we'll break it down. What does it mean for social communication? So differences in verbal and nonverbal communication. So one with autism may be totally fine speaking, no issues at all, whereas one may use a talker or an iPad or a device to help communicate. Variations in social interactions, they may understand social cues or relationships, or they may not. And so because you've met one person with autism means you've met one person with autism. And so no two are alike. And there, with the spectrum, there are so many different needs. We are seeing it more even in TV shows. So when Big Bang Theory came out, right, it was back then it was still Asperger's, and then the Young Sheldon show, and how it evolved and his love and focus and fixation on science. But then it also really played on that social interaction piece, right? And so that allowed people to kind of get an idea of what this was. And then timing is ironic. Even so, yesterday, I don't know if anyone saw, but Mattel came out announcing their first Barbie, who is going to show that the Barbie has autism in terms of like having headphones on or having I think it's the talking device and having some fidgets. And so trying to kind of normalize some of these things and so that we can accept others in the community without judgment, because that is a huge piece. How it could come across, oh, I went the wrong way. How it could come across. So may or may not, that should say are, or sorry, may or may not come across as rude. They may or may not make eye contact. They may take things very literal. They may use different tools to communicate. They may prefer one-on-one or small groups. They may have different ways of showing interest or empathy. They may need explicit communication rather than hints or implied meaning. Uh, Taking language literally, so they don't understand sarcasm necessarily or idioms. Difficulty knowing when it's their turn to speak, appearing neutral or flat when they actually feel really deeply about something, becoming socially fatigued more quickly, needing downtime after social interaction. It's so hard that it's physically and emotionally exhausting. Doing better with written communication than spoken conversations, and missing subtle social signals like boredom or discomfort. So, a couple examples for this. So, my 5-year-old is diagnosed autism. And so his dad jokes with him all the time, and he finally the other day he's like, I don't get jokes. They make me mad, but he jokes all the time. But that's fine. He just for him, he wasn't understanding that or wasn't understanding sarcasm. And so I often forget those things. And so, I'm like, okay, bud, I'll be in there in 2 minutes. And he like starts his little timer. He's like, Mom, it's been 2 minutes. And I'm like, oh my God, yeah, okay, yeah, I'm on my way. Um, or I've had a client where they were in a training program and the teacher said, if you have any questions, like ask anytime. And so he takes that literal and he asked every single time. And then it was like, you're harassing me. And it's like, well, no, you told me to ask every time, right? And so just those little things that we don't really realize can have a huge effect on somebody's day to day and how they're functioning and how things work for them in the real world. So again, this will look different for everybody. This is not an extensive list. There's so many more, but these are how they could potentially present in terms of social communication. For sensory processing, so what it means, it could be a heightened or reduced sensitivity to sound, light, touch, taste, movement, and then how that could look. So it could be a hypersensitivity. So they feel things, it's overwhelming or painful. So often like tags on shirts or the way socks feel, or reduced sensitivity. So it's like almost muted or hard to notice. They are sensory seeking. And so it could be like my son's an oral fixer, so he'll be like chewing his tongue constantly, or we go through a lot of gum when he's seeking that sensory fixation to kind of calm, or also known as like stimming. Sensory avoidance. So you know that you're going to be overwhelmed. There's going to be too much if you go to a football game because there's going to be too many people. It's going to be too loud. The lights are going to be too bright. Sensory overload. It's like, okay, I'm just not going. But these are ways that it could look in terms of the sensory processing piece. Repetitive behaviors and routines. So huge is a preference for predictability, routines, or repeated movements. I'm sorry, this shifted funny. And then a deep focus and interest. So preference and predictability is huge. And I know I make mention because I live this every day with my kiddo. But the other thing we often don't talk about is, everyone goes, why there's so many more diagnoses now? Like there's just so many more people with autism. And it's always been there. It's just now we know what it is, right? And it's not, oh, that kid's weird, or that guy is doing this, or this girl's doing that. It's now we know what it is and we know how to support, right? And so the more we know, the more we can help. And before we didn't know what we didn't know, right? And so for us at home, I've got a calendar up and it's got little pictures. And so there's a picture of the school and which days he has school. It's taped on the calendar. And if we're going to go somewhere that I know for sure we're going to go, it's on there. But allows for that routine and that predictability that takes away that angst and that fear of not knowing, right? So there can be repetitive movements, so often called stimming. So some of the common ones that we see, like people will rock or tap their foot or shake their hands. So this is done to self-soothe, to concentrate, to express emotion, or to manage a sensory input. So it's a way that it helps them manage. Repetitive speech or thought. Sometimes I feel like I live with a parrot, and that's okay. I just get used to it, right? But it could be, like, oh, it's sunny out, sunny out, sunny out, sunny out, or maybe it's repeating something until they get to write it down if you're in the workplace, right? Again, this can look different for absolutely everybody. Routines and predictability, I mentioned, and then focus or intense interest. And so people do often will have a topic and it's like a deep dive, and they are an expert on that topic. And so, if there's ways to incorporate these topics or interests into the workplace or into the work they're doing, that individual is going to be highly more successful because it's working with their interests and their loves while they're doing the work. And that'll come out when we talk about a little bit about some some solutions and things to help with. And then could look as repetitive player activities. So you'll often hear like someone who they've seen a movie they like, they'll rewatch the movie like 100 times because it's also predictable. They know how it's going to end, or they listen to the same song. It's comforting for them. When routines are disrupted or there's unexpected changes, it can lead to anxiety, distress, sensory overload, shutdown, or meltdowns. And so the more that can be predicted, the better. Of course, there's going to be things that are unpredictable. That's just how life goes. But the more that we are able to control and help with, the better things will be. Cognitive and learning styles, so different in information processing, problem solving, and attention. It may include strong pattern recognition, or detailed focus for thinking. So it could look like for information processing is thinking in detail before the big picture, so kind of getting ahead of themselves. Attention and focus could be intense, sustained focus on topics of interest, so that hyper focus piece on that topic or thing that's interest of them. Learning preferences, learning best through visuals, written instruction, hands-on experiences, or they struggle with lecture only or abstract teaching. So again, just knowing the preference of learning style for that individual. Memory, strong long-term memory for facts, system, and experiences. This does not work in my favor at home. Remember last year when you said, and you'll have that, right? Where you'll say, oh, this kid has a memory like an elephant. And so, but then difficulty with short-term or working memory. So it's kind of a blessing and a curse if you're supporting somebody with that because it's a skill. And that's one thing too, as I know I'll mention, but this isn't a hindrance, right? It's a skill, and we often refer to both autism and ADHD in our house as the gift, because there are things that individuals with these things have that nobody else has, right? And that's what makes our world so amazing. Problem solving, difficulty with with open-ended tasks without clear criteria. Language and thinking, so thinking in images, patterns, or systems rather than words. And then executive functioning. So executive functioning will come up as well in ADHD, but the planning, organizing, starting tasks, managing time. And that's what I should mention too, is a lot of these neurodiverse or neurodivergence are comorbids. So you may experience autism, but also experience ADHD, and that can be common as well. So you will see overlap in some of the symptoms. Support needs. So what it means, and it might range from minimal support to substantial ongoing support in daily life. So it could be daily living supports, and again, depends on where the individual is on the spectrum. They may need communication supports, they need learning and workplace supports. And so this is a big one that we're seeing more and more now in the workplace. And part of it is too, as I mentioned, is it wasn't talked about before, right? And I often use ADHD as the example for this, but it will be, you always had that kid that talked so much in class and got in trouble and was always kicked out or always at the principal's office. And you look back now and you're like, oh, they had ADHD, right? And they were bored in class or their needs weren't being met. It wasn't that they were a bad kid, but they got labeled the bad kid. And so now that kiddo is now an adult in society, right? And we go, how do we support this individual in the workplace? Because that's where we're at now, right? Is learning these things. And I was talking to a parent at drop off the other day, and she goes, yeah, my husband just got diagnosed once we got our son diagnosed with ADHD. And I go, yeah, because we didn't know, right? And like I said, we didn't know what we didn't know, and now we do, and it's just going to help everyone's lives get better. But then in the workplace, how do we integrate these supports and support everybody? So clear, structured instruction and predictable routines as much as possible. Visual schedules, checklists, step-by-step guides, quiet spaces to reduce sensory overload, flexible deadlines or task adjustments, and then regular feedback or mentoring. An individual may need sensory supports, they may need emotional or mental health supports, or they may need social supports. And so I started the presentation with that quote at the beginning about communicating and that it's sometimes hard to do, but it's imperative to do because that's what's going to help everyone be most successful, both the employer and the individual, the employee. So how might autism look in the workplace? And so might be how it shows up. And the other thing is individuals don't have to disclose their needs, right? Or their diagnostics. And a diagnosis doesn't identify the entire individual, right? Doesn't mean that that's who they are because like I said, everyone's different and everyone brings a different case. So what it may look like is difficulty sustaining attention during meetings, zoning out during presentations or discussions, being easily distracted by noise, movement, emails, thoughts, difficulty prioritizing what to do first, starting tasks but then struggling to finish them, needing reminders to follow through, disorganized digital or physical workplaces, losing track of documents, emails, deadlines, running late, forgetting verbal instruction and meeting details, needing information repeated or written down, losing track of conversations, feeling overwhelmed by competing demands, increased stress, frustration, or self-doubt. And again, there's way more, right? It could be you see someone getting up from their desk a lot, or you see somebody that's, constantly rocking in their chair, or someone that's off humming, right? Depending if they have like needs a verbal stim or needs to rock in a chair or needs to be standing. And so these are things that you may be thinking, and you could probably even think of somebody in your workplace that you're like, oh yeah, okay, that might make sense, right? And they don't have to have a diagnosis to need support, right? That's the other thing, is just what's going to help everyone be their best selves. How can we support autism in the workplace? Normalize neurodiversity. So treat autism as a difference and not a deficit. And I think that's the huge part. As I mentioned, we talk about it at home as it's the gift. And that's a huge piece. You don't want people to be ashamed of themselves or what they bring, because they have no control over that. We can't control how our brain is wired. Avoid assumptions about abilities or challenges. Clear, direct communication. Give explicit instructions, so written or verbal, whenever possible. Sensory-friendly work environment, so thinking of lights, sounds, flexibility, predictability and structure, so consistent schedules and routines. Advance notice for changes whenever possible. Again, not always possible, and especially in the world of healthcare, right? You don't know necessarily, but as best as possible. Clear role definitions and job descriptions. Flexible work options, so task-based versus time-based, and then being flexible with those times. Because often if it's you're given, you have 10 minutes, it's like, oh my God, I forgot I have 10 minutes, versus, okay, you have step 1, 2, 3. Okay, I can do step 1, 2, 3, right? You'll still get those steps done in the 10 minutes, but it just takes away that angst. Fair performance management, so focusing on outcomes and not social styles. Provide regular check-ins rather than surprise reviews. Neurodiversity training for managers and teams, so similar to kind of what's going on today as well. But the more you know, the more you can help. Um, and then I like saying, the more you know, the more you grow. Psychological safety, so making accommodations routine and not special favors, right? When sometimes people can be embarrassed if they need an accommodation or they don't want to feel special. But if we're just doing it because it's routine and it's like, hey, this is what helps me work better, then that's what we do, right? I know I can't see anyone, but I'm sure some have headphones on or AirPods in because they're in a space with other people, right? We don't question that because you're on a call and you need to hear what you're doing. So but that's an accommodation and it's become routine that nobody questions it. So kind of doing that for everybody and then communicating with individuals. So the big one is what helps you do your best work, right? How can I support you? How can I help you be better, do better? What's going to help you be your best self? Um, the key points with autism to understand, as I mentioned, like if you've met one person with autism, you've met one person with autism. Strengths and challenges can coexist in different areas. Support needs can be changed over time and across environments. So depending where an individual is, the needs that they have in the workplace aren't necessarily going to be the same needs that they have at home, right? Because at home is their safe place, they know what works for them, but at work there may be different needs. So they may change from day to day, week to week, environment to environment. And being autistic is a neurodevelopmental difference, not a personality trait or illness. So they're no different than any other individual, right? We're just all neurodiverse. And I know I could have made a list, but I know in the last, I'd say, year or two, right? Like Elon Musk came out, Jerry Seinfeld came out, not Steve Jobs because he's passed, but his counterpart for talking about, anyways, it's escaped me, but they have come out and said like, oh, I have autism or I have any of this to help them help, I guess, reduce the stigma, right? I have these needs. I am autistic or I have ADHD, but look, I'm still this successful. I just saw the chat there because that's what, oops, got me away for a second. And yes, no employee is not required to disclose a diagnosis. Absolutely. But if they would like adaptations and modifications, then 100%, yes. You don't have to share the health information. No, absolutely. And I'm sure it looks like that's already getting responded there too. Okay. So is there any, maybe I'll save questions till the end just to make sure we kind of get through all this stuff first. But um, so ADHD, attention deficit hyperactive disorder, it used to be it was over a decade now. There was ADD, which was just attention deficit disorder. And then there was ADHD, which is attention deficit hyperactive disorder. And then there was ADHDC, which was attention deficit hyperactive disorder combined type. And so now it's just ADHD, and then that's the diagnoses of just ADHD. And then how it would be supported would be, oh, this individual's inattentive, or has inattention, this one's hyperactive, or this one's impulsive. So it breaks down a little bit differently, but it's just the ADHD diagnostic. So it affects how an individual regulates attention, focus, activity levels, which is the hyperactivity piece, impulsivity, executive functioning, which again, we mentioned in the autism piece with planning, focusing, remembering, juggling tasks, and it reflects differences in how the brain manages focus and self-regulation. So breaking it down, there's the core features, as I mentioned. So an individual may experience primarily inattentive ADHD, whereas they're may come across as more like introverted, pretty chill, but they like zone in and then like the world's passing them by around them. They just are like so focused on what they're doing, like hyper focused. There's the hyperactivity, impulsive ADHD, where it's like, oh, this person's super hyper, like they're bouncing off the walls, like can't sit still, they're jumping out of their chair. Or there's the combined presentation where there's bits of both pieces. And then the core features that we're looking at in ADHD is the inattention, hyperactive, and the impulsivity. And then also kind of on the outer bubble here is the executive functioning differences. So if we're looking at inattention, how it could look, difficulty sustaining focus on tasks that aren't highly engaging. So if they're not super interested in them, it's going to almost be painful to try to get through. And keep in mind, like everyone has those, right? Everyone's like, oh, I really don't want to do this. This is painful. But we're talking in a way that it's hard. You can't stay focused on the task. You're easily distracted by thoughts or surroundings. And then there's kind of more coming into that other than I don't want to do the task, right? Forgetfulness or losing things, trouble organizing tasks, time, or materials, or also making decisions. Decision making can also fit into that one as well. Hyperactivity, so it could look like restlessness or feeling like you're driven by a motor. And so it's like you get up and you go, 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 go. You're literally like on super speed all day. And then at the end of the day, it's like bed and you crash because you've just been literally like driven by a motor all day. A lot of fidgeting, tapping, difficulty sitting still. And so for some of those tools that we've seen kind of come into the school setting is like there's the rocking chairs, there's some bands that go on the bottom of your chair to move your feet, bunch of fidget tools. So a lot of different tools like that have kind of come into play and also in the workforce. And then excessive talking in some people. So I remember as a kid being told, like, you don't stop talking. Like, holy man, she's exhausting. Holy man, she's high. She's not. I'm like, yep, got it. And well, now it all makes sense. But in that time, it was that this one just doesn't stop talking. And you look back on those report cards that when you had to have all those comments, and it was like, so and so talks a lot in class. And you're like, oh, shocker. There you go. How it could look for impulsivity. So acting or speaking without thinking. So you do something and then it's like, oh, why did I do that? Difficulty waiting or taking turns, and then interrupting others. So the thought that the idea is there and you're worried you're going to lose it, so you just shout it out. But as a result, you end up interrupting somebody else. But if you don't, part of it's like that impulse piece. But if you don't, you've lost the thought because it's gone. And so, then it comes across like, well, you're rude, you don't take turns, things like that. But it's all a part of the ADHD piece. How ADHD can affect executive functioning, planning and prioritizing. Starting and finishing tasks, time management. So it's like, oh, this person's always running late, or they feel they have more time to do something, or saving things till the last minute is always one of them as well. And then emotional regulation. It's really hard to self-regulate, to calm down when I'm really worked up from one of those tasks. So it's much more difficult to work through these executive functioning skills. There are strengths 100% in ADHD, and like I often refer to as that gift. So creativity and original thinking, hyper focus on areas of interest. So we're talking about creativity and original thinking, like coming up with ideas that nobody else would think of, right? Or hyper focus on area of interest, like I am so into this, like I am doing this presentation, like I sat and did this presentation for hours, and my kids were like, "What is happening?" They weren't home, but then they came home and they're like, "What is happening?" Or my husband's like, "Holy smack!" And I'm like, yeah, super interested in it. This is my jam, right? And so then it's an area of interest and I can really dive into it. Um, High energy and enthusiastic is one, and then strong problem solving skills in dynamic situations. So kind of able to perform in that under pressure piece because they're often putting themselves under pressure with like those late deadlines and things like that. So turning some of these symptoms into strengths and using them to the best of their ability. How might ADHD look in the workplace? So again, we're going to see a little bit of overlap to the autism piece, but difficulty sustaining attention during meetings, zoning out during presentations or discussions. So they get thinking about something else and just completely zone out. Being easily distracted by noise or movement, emails or thoughts, difficulty prioritizing what to do first, starting on tasks, but then struggling to finish them or just not finishing them, right? And how many have started a project at home and then the project sits there and it's like, now I have 5 projects on the go, or I'm going to clean out my closet. So you take the whole closet apart and then halfway through, you're like, oh, I'm done. I'm distracted. And now you've got clothes everywhere, right? So starting these tasks, but not finishing them, needing reminders to follow through, disorganized digital or physical spaces, losing track of documents, emails, or deadlines, running late, forgetting verbal instruction or meeting details, needing information repeated or written down, losing track of conversations, feeling overwhelmed by competing demands, and then increased stress, frustration, and self-doubt. Because again, if a lot of these ones above are happening, the individual will feel like they're failing. And so then if you feel like you're failing over and over, you become stressed, frustrated, and then you just start to doubt yourself. And so then that then leads to an effect on the individual's mental health. So how can we then support this in the workplace? Providing clear structure and expectations. So give written instructions to accompany verbal ones, break large projects into smaller, like defined steps. And it could be a checklist, it could be step by step, clearly stating priorities, deadlines, and success criteria. Avoid vague directions like when you get a chance, because when you get a chance, like, well, I never got a chance, right? So it's like, I need this by tomorrow at noon. So avoiding that vague piece, supporting attention and focus. So keeping meetings purposeful, also with agenda and notes. So again, this kind of can overlap as well with the autism piece, right? It keeps to a planned purpose and rigidity that is help kind of, but also being flexible, which is, I know this counteracts itself in a second, but when it comes to meetings, if they have a list of what's going to happen on the agenda, then they've got that written piece, which is helping that working memory, but also something to follow and go back on. Building flexibility into the work. So focus on outcomes and not rigid processes. So it's not, okay, this is the outcome of the project. You can get through it by taking path A, or you can take to it by getting to path B, right? But it's not, okay, well, you have to do it on path C. And that's like rigid can become an issue because if they get off task, then they feel they failed. And how did they get themselves back? Be open to quiet workspaces or remote options, normalizing accommodations we talked about, communicate consistently and directly, giving effective feedback, so support executive function, as we mentioned, and then fostering psychological safety. So it's really easy for mental health to slip when ADHD is affecting the workplace and the individual doesn't feel like they're being successful or feel like people are judging them or that they're not good enough, then the psychological safety quickly begins to fail as well. So it kind of all has to work together. And again, it all comes back to that communication piece, right? They don't need to disclose, hey, I have ADHD. They can disclose, hey, this is what helps me work better. I'm just going to check the chat here quickly. Let's see if there's Oh, yes, The Good Doctor. Absolutely. I love The Good Doctor. It is a great show that helps explain some of these ones as well, and how the surgeon has autism, and um, how also they can be successful, right? And so, yes, I forgot about that show. That was a good one. Thank you. Dyslexia. So these ones are a bit shorter. There's not quite as much content, but LD stands for learning disability or learning disorder, depending on kind of where you're looking at, or now it's moving to difference. So we are again changing that language instead of disability or disorder to difference. So dyslexia is a neurodevelopment learning difference that primarily affects reading, spelling, and written language. So with reading, difficulty decoding words, so connecting letters to sounds, slow and effortful reading, so they may be a very slow reader, they're trying super hard though, and then trouble with reading accuracy and fluency. Spelling and writing, so inconsistent or phonetic spelling, difficulty organizing written language, and then trouble with grammar or punctuation. And then language processing. So difficulty breaking words into sounds, trouble remembering sequences, and then difficulty with rapid naming. So like quickly recalling words or symbols. Strengths with dyslexia, strong problem solving and reasoning skills, big picture and system thinking, creativity and innovation, and then visual spatial strengths. So again, making sure that we're aware of the strengths that come with these neurodivergent I don't want to say the diagnoses, but that come with these symptoms as well. So how might we support dyslexia in the workplace? Slower reading speed, especially with dense text, difficulty, or sorry, how might it look in the workplace, not support? Difficulty skimming emails. They may need to reread texts multiple times. They may misread similar looking words or numbers. Spelling errors despite strong verbal skills. They may take longer to compose an email or report. They may avoid writing heavy tasks when possible. They might have difficulty remembering written instruction. They may have stronger recall for verbal information than written, and they might prefer verbal explanations over written ones. So they might struggle while taking notes while listening, right? Whereas if we are looking at autism or ADHD, they may prefer written communication over verbal, right? So it's just knowing kind of how the individual is going to learn best. And then how we can support dyslexia in the workplace. So make written information more accessible, break text into short paragraphs and bullet points using clear, plain language, offer alternative to text-heavy tasks, allow verbal instructions alongside written ones, use diagrams, flowcharts, visuals, record meetings or provide audio summaries, accept voice notes and dictated drafts when appropriate, support reading and writing tasks, so allow extra time, clarify expectations, reduce cognitive load, normalize accommodations, which I know I've made mention 100 times, but frame the supports as productivity tools and not exceptions. And then leverage strength, right? You've got tons of strengths. Let's use those and see how that's going to help you work best. I'm going to talk on dyscalculia, and then we'll move on to kind of wrapping things up towards the end here, and if there's any questions as well. So dyscalculia affects how a person understands and works with numbers, quantities, and the numerical concepts. It's a neurodevelopmental learning difference, so it's not a reflection of intelligence, effort, or capability by any means. So it means difficulty working with numbers, trouble with time and scheduling, difficulty and or confusion with data or measurements, difficulty following numerical instructions, struggles with technology and systems, and emotional and cognitive impact. Strengths would be verbal communication, they're creative or strategic thinking, they're great at big picture problem solving or interpersonal or hands-on roles. So just finding those strengths that's going to help support that individual. It may look like they have difficulty doing mental math or quick calculations. They might have trouble estimating, difficulty telling time on an analog clock, which I feel is like many people now because there's everything is digital. Trouble estimating how long tasks will take, struggling with schedules or timelines, difficulty interpreting charts or drafts. So again, like as I mentioned, some of the strengths that are needed for other needs are more difficult for others, right? So it's just knowing you're human and what tool is going to work best for them. Errors when recording numerical data, confusion with measurements, errors in data entry involving numbers, increased anxiety around number-based tasks, and then fatigue, sorry, spelling error, from consistent effort to compensate. So it's exhausting when you feel you're having to try to be perfect all the time. And it's not even just trying to be perfect, but it's trying to do it right because you're dealing with a learning need, right? And so finding ways to work with that learning need is going to help support that individual to be their best selves. We can support them by making tasks accessible, so using calculators, spreadsheets, formula tools, giving examples of completed work for reference, so they have a guide as to what they're looking at, presenting things clearly in simple layout, so it's not overwhelming, breaking the information down to small sequential steps, supporting time and scheduling, so breaking long projects into little steps, providing written timelines and deadlines, clarifying instructions and expectations, so giving step-by-step written instruction, reducing pressure and anxiety, normalizing again those tools and accommodations. And the supports are for accuracy and efficiency, right? Not exceptions. And then again, levering those strengths. I'm going to, dysgraphia is written, and so it affects written expression in the physical act of actually writing, difficulty with fine motor, trouble with written expression, difficulty with speed and efficiency, difficulty with working memory and multitasking, and then it has an emotional impact. And so strengths then for dysgraphia would be verbal communication, problem solving and reasoning, and then creative and conceptual thinking. In the workplace, it may look like handwriting is slow, it's difficult to read, it's really tiring. They experience actual hand pain or fatigue during writing. They have difficulty with note taking. They have trouble translating thoughts into words, difficulty structuring sentences or paragraphs. They're writing less than expected just to avoid the struggle and the difficulty they have. Taking significantly longer to complete writing tasks. They're falling behind on documentation, writing that does not reflect the knowledge or skill that you know that individual has, which then leads to them being frustrated or anxious and avoiding writing tasks, and then reduced confidence to, fear of being judged or writing on their writing quality and just not being their best selves. And it's not that they're not capable, it's that they actually have a learning difference. So to support them, we can provide alternatives, audio notes, recorded updates when appropriate, reducing writing loads if possible, supporting written expression, support note-taking in meetings, and then so like sharing agendas and materials in advance, right? Allowing that time to prep, allowing laptops or tablets for note-taking, using assistive technology, again, normalizing accommodations, and then leveraging strength. Emphasize that they rely on verbal communication strategy, creativity, or problem solving. So there's a way to work with this. We don't have time to go through the case studies, and we actually didn't know we were going to have such a great, huge group, which is amazing. So what I'm going to do though is I'm just going to show one example together as a group so that we can see how this could look. And so I think I will do this one here. And so and actually I'll just check these questions here quickly. Yes, I think you are going to be getting a copy of the presentation. There will be a video of it sent out as well. And then OCD, we aren't going to have time to get to today, but maybe we can do a part two, because yes, that does also fall under that umbrella as well. And then what makes accommodations conversations easier or harder for neurodivergent employees, and how leaders can reduce burden of having neurodivergent employees constantly self-advocate. That's a really good question too. I like that. Is maybe, oh, I like the idea too. What makes the accommodation conversations easier and harder is if there's almost like when you have people come in as a new employee, is it conversations of like, is there anything we can do to help you in the workplace, right? Like, we have to, like, is there any things of accommodations when we have, sorry, I'm going to close chat and get distracted because I get distracted. Oops. Is there any use of technology that you need that would find helpful? Do you have any specific learning styles that I can be supported of? So just normalizing that conversation can be helpful too. So this one here is an ASD individual sensory sensitivity in a healthcare setting. So Alex is 29-year-old registered nurse working on a busy medical surgical unit. Alex is autistic and is known for being detail-oriented, calm in emergencies, and highly attentive to patient safety. They follow protocols carefully, document thoroughly, and are well regarded by patients for their clear, compassionate communication. So workplace challenges, this unit is brightly lit overhead, fluorescent lighting that remains on throughout long shifts. The lights are particularly intense at the nursing station, medication preparation areas, and charting spaces. While these lights conditions are standard for the unit, Alex experiences them as harsh and overwhelming. So as the shifts progress, the constant exposure to bright flickering light leads to eye strain, headaches, nausea, and increased sensory overload. By the latter half of the 12-hour shift, Alex finds it harder to concentrate while charting, processing verbal information, or transitioning quickly between tasks. So something like the lights is then creating quite a struggle for Alex to do the work. So how it may be misinterpreted is that without knowing that Alex is experiencing a sensory processing difference, the behavior could be misinterpreted as burnout or stress or intolerance or difficulty managing a workload, when really their requesting change might be seen as an inability to handle demands of bedside nursing. And so the underlying issue is that the sensory overload is caused by prolonged exposure to the inside lights, not lack of competence or resilience or professionalism. So the environment creates an accessibility barrier for Alex's neurological sensory processing. And so then potentially how Alex could be supported is using softer task lighting for charting when clinically appropriate, adjusting break spaces with dimmer lights, permission to wear tinted or anti-glare glasses, temporary charting in lower stimulation areas, flexible scheduling, or shorter shifts when feasible. And actually what I'd seen in a classroom was there was like, she ordered them off Amazon, but it was almost like a sheet and it was magnetic, and they were able to put the magnets over top of the fluorescent lights, and then it changed like the filter that it came out. So instead of it being like a 5,000 lumen, it was like 3,000 lumen. So it wasn't like the white light, it was like the calmer yellow light. So anyways, there's more and more tools out there. And then potential outcome is with appropriate sensory accommodations, Alex would likely experience reduced fatigue, improve concentration, and sustain highly quality patient care throughout the shift. We're almost running to the end here, so I'm going to just kind of skip to the end piece here, but how we can support neurodiversity in the workplace. And so the one thing we need to remember, and this is for neurodiversity, so whether it's neurodivergent or neurotypical, everyone, how we can support it in the workplace is having clarity, flexibility, trust, and then at the center of it, empathy. And so I was going to show the video, but we're going to be out of time. So, but it was going to be the video, which I know as soon as I showed it to the team leading here, they're like, oh, yeah, the Brene Brown empathy versus sympathy, right? And so it's not like, oh, that must be hard for you. It's like, oh, how can I support you? Like, how can I make things better? That must be really difficult, right? It must be really hard for Alex to get home at the end of the day and just feel completely drained and have a headache and eyes hurting. And so, what can we do to kind of help that situation? And so responding with clarity, flexibility, empathy, and trust. There's that video. But providing clear and structured expectations, supporting attention and focus. And this is kind of just an overall with neurodiversity, right? As I had broken it down earlier, more specific, but building flexibility into work, normalizing accommodations, so framing accommodations as tools and not special treatment, making sure you're asking like what helps you do your best work, and keeping discussions private, non-judgmental, and avoid requiring disclosure of diagnoses. So as you had mentioned, like as a leader, how would you do that? And it could be like when a new member comes in, it could be, okay, like, is there anything we can do to help you be your best self? Whether that's an adaptation in the environment or, taking that label away. Or if it's, now it could be sending out a Google Doc and be like, hey, do you find that your workspace works for you? Is there anything you could use change that, you could do it anonymous, you could do it that individual needs depending on the situation, but it's never too late to make changes and improve things. Communicate consistently and directly. So communication is always a big one. Giving effective feedback, supporting executive functioning, fostering psychological safety, and then routine. But allowing that psychological safety is going to be huge. And then also using kind of a traditional lens piece. So I'd love to be able to spend more time on it, but how we fit either the medicine wheel or the sacred hoop, depending where you're coming from, what it is called, and depending the elder, the teaching it's from, and then also the seven sacred teachings. So understanding that humility, truth, courage, love, respect, wisdom, and honesty all fit into clarity, flexibility, trust, and empathy. And so approaching the neurodivergent aspect of things and neurodiversity in general through a traditional lens just allows everybody to feel their best selves and how that could look as one. This is the question piece. So we'll try to, I'm going to stop sharing here, get to questions as best we can. I will show quickly. I know some people had to go. This is the handout that I have for everyone that will be coming out via email. So it's pieces directly from the PowerPoint. So you'll have those key items that can help kind of be implemented right away and right off the get-go. There's some actual information there. Okay, I think that's it for me. So I'll hand it back over to Jeffrey. Thank you. Like I said, that could have been like a whole day workshop, but I kind of just like threw it all at you. So I'm sure there's a little bit of overwhelm, and I apologize for that.
I can totally relate because it's like you just have so much great information. And I work in mental health and psychological health and safety, so I can completely relate. I think, it was interesting watching the dynamics in the chat. A lot of people were kind of answering other questions for folks. One of the through lines I noticed was just, we throw around the word communication a lot. And sometimes it's kind of like glassy eyed, like, oh boy, there's that word again. But it really does, in my experience, come down to kind of that psychological safety at the team level and do your best. It's a fine line as leaders and supervisors, like meeting accommodation with a capital A for people and their unique needs. And there needs to be some degree of disclosure if that person's going to have a bona fide accommodation versus the things that are going to support the whole team. And some of the comments in the chat have been like, well, all of this, like even that diagram, that Venn diagram with empathy, like that's great for everybody. It's not just neurodiverse folks, right? So I think expanding that to include anyone with really an internal or an invisible, I hate to call it a disability or a factor that only they know about, but that's a challenge. So for me, that psychological safety piece is just so huge. And I know Lisa did put some links in there. There's one called the Decide tool, which is out by the Institute for Work and Health. I don't know, Andrea, if you're familiar with this,
Not
but
actually.
it's a methodology and a self-driven tool for workers to think about like what's going on in their minds as to how they're going to what they're going to share with their supervisor, with their teams, with regard to some of the accommodations they might need. So there's a spectrum, right? And almost like a diversity of accommodations that are more team oriented versus individual. And I think sometimes that's where things get sticky. But yeah, we could talk all afternoon about this, and it's a huge interest in nurses, I think, because the role we play in the workplace is we treat workers as whole human beings. We bring our whole selves to work. And so when it comes to, return to work, accommodation, helping support health and safety committees, there's just a lot we bring to the table. And so once again, a plug to Monig. If you're interested in joining or wanting to learn more about what an OHN role includes here in Manitoba as well as in Canada, you can email me at gthompson@ohcmb.ca. And I think, Andrea, you were going to share a link to a Google document.
Yeah. And I'm
Okay.
also putting that's my direct email too, if anyone needs it. And then I had it already, and of course now it disappeared on me. But and
I wish there was a way for people to speak. A webinar format doesn't allow for that. Of course, we're a big group. But thank you. We'll look back at some of these questions. And if you want to follow up with Andrea, you seemed open to accepting some of that after the case. I know some very specific questions came through about like where to get different kinds of diagnoses like OCD or ADHD. And I don't know those off the top of my head, but perhaps you do, and you could support some of that. But yeah, so this was really great.
I'm just trying to get my thing here for the link. There it is. So all this link is if you want me to contact you directly with the handout, I can send it to you with your email. But I think now we decided that I'm just going to send it to Tiffany and she's going to directly send it out, right?
That would work too.
Okay, so
I
maybe
think,
we'll just
yeah,
do
yeah.
that.
Let's go ahead and do that because some people had to leave already. We're down to
Right. Yeah.
104.
So
Yeah.
that's even better then. Then we don't have to worry about it.
Okay.
Perfect.
All right. Well, thank you, Andrea. Thank you to everyone for attending. And yes, we hope to do more webinars like this in the future.
Yes. Thanks so much for having me.
Take care, everyone.
Take care. Bye-bye.